We're going to be chatting this morning about the federal government finalizing a rule that refuses to classify nurses as nursing as a professional degree. Hey, Neil, would you mind dropping the music for me, my friend? Thank you so much, buddy. If you're watching on television, welcome on in. Fox 10 Talks. If you're watching on YouTube, hello to you, and say hi in the chat this morning. Thank you for all the hearts and the likes this morning. We have a very special guest, Anita, in studio.
Yeah, Jasmine Body.
Thank you for having me.
Thank you. You are a registered nurse.
Yes.
And so this is very interesting because I think that this will affect a lot of people. We have the federal government finalizing a rule that refuses to classify nursing as a professional degree. So a designation that will cap how much grad students can borrow for advanced nursing programs at half the limit of fields like law and medicine. Break down what that means, not just as far as how much money you're borrowing, but how that position is characterized when you're actually working in it.
Yeah. Well, I think there's two things to be talking about, right? So I think when we talk about nursing and we say that it's no longer professional, you know, we're the most trusted profession in the U.S. consistently year after year, and I think language is really important. And it's almost demoralizing to the profession as a whole when we declassify that in general. But as it operates in the country, you know, we think about nurses that are going on for advanced degrees. These are our nurse practitioners. They are CRNAs. They're nurse midwives. Did you know that almost 80% of all of the anesthesiology that's provided in rural areas are provided by nurse anesthetists, right? 25% of our primary care is provided by nurse practitioners in rural communities. And so what this will potentially do is we're already seeing nurses who are saying, hey, I'm practicing, but I'm not going to go back to grad school. And in reducing the amount of people that are going to be able to go and practice as nurse practitioners, as CRNAs, as nurse midwives, we're not going to have enough people to care for people in rural communities. And as we don't have people to care for them there, those people are going to start to come into the larger cities, and what that's going to do is delay diagnosis. It's going to impact how you receive your care. It's going to delay and impact your outcome.
And we already have a bit of a nursing shortage. There has been for a number of years. And what do you think this does to the future of the profession in terms of, you know, does it, you know, put somewhat of a halt on people saying, well, if it's not really a professional program, or if I have to pay for my education in a certain way, maybe I'll choose a different profession? Exactly.
So unless we see some changes within universities and colleges themselves where they're going to help reduce the cost, or maybe there's access to more scholarships, students will have to rely on private loans in addition to the federal loans that have been minimized. You know, I think a lot of them are going to decide, hey, I'm not going to even go that route anyways, and that compounds the fact that when we have nurses that come to enter into practice, about 24% of them leave within their first year as it is. We're expected to see 40% of our nursing workforce drop off within the next 5 years as well. And so we've got this aging population who have increasing needs of care and not enough people already to provide the care, and now we're going to not have enough nurses to funnel into the workforce itself. And not only does that affect the nurses, it's going to affect everyone that we're providing care to, but the entire system that we work within, all of the collaborators, the physicians. It's going to burn everyone else around out because they're not going to have enough of us to help do the work we need to do.
This is primarily, and just to be sure that we're getting it right, this is primarily a designation that's going to talk about this financial. This is not downgrading the title and what you do. It's making it harder to get that title.
I mean, it is in a sense of like not being considered a professional degree anymore, right? That is a downgrade in the language itself. But as far as a degree, that stays the same.
You know, a couple of comments. It says, Louis Gonzalez says, without nurses, hospitals and doctors' offices would not run. We've had a couple of other, you know, he says, Burger Boy, not for nurses. Of course, doctors wouldn't be able to do the job. There's so many different parts of healthcare that really do rely on nurses. When did you become a nurse?
So I've been a nurse for 15 years now.